Hello everyone. In this video, we will discuss three important drugs used in critically ill patients to support the heart and blood pressure. These drugs are dopamine, dobutamine, and norepinephrine. These medications are called inotropes or vasopressors because they help improve blood flow to the vital organs when the heart is weak or blood pressure is dangerously low. By the end of this video, you will understand how these drugs work, their common indications, their dosages, and the difference between them in simple language. So, what are inotropes? Inotropes are the medicines that make the heart pump stronger and improve blood flow throughout the body. They are mainly used in emergency and intensive care settings. Doctors commonly use these drugs in patients with cardiogenic shock, septic shock, severe heart failure after cardiac surgery, or in patients with severe low blood pressure. When blood pressure drops significantly, organs like the brain, kidneys, and heart do not receive oxygen, and inotropes help maintain blood circulation and protect these organs from damage. Now, let us discuss the first drug, dopamine. Dopamine is a unique drug because its effect depends on the dose. At low doses, between 1 and 3 micrograms per kilogram per minute, dopamine acts on dopamine receptors and increases the blood flow to the kidneys and intestine. At moderate doses, between 3 and 10 micrograms per kilogram per minute, it stimulates beta 1 receptors. This increases heart rate and strengthens the contraction of the heart. At higher doses, above 10 micrograms per kilogram per minute, dopamine stimulates alpha receptors, causing blood vessels to constrict and blood pressure to rise. Dopamine is often used in patients with cardiogenic shock, symptomatic bradycardia, and severe hypotension. The usual starting dose is 2 to 5 micrograms per kilogram per minute by intravenous infusion, and the dose can be increased according to the patient's response. However, dopamine can cause side effects like rapid heart rate, irregular heartbeat, poor blood supply to the limbs, and tissue damage if the drug leaks outside the vein. Next is dobutamine. Dobutamine mainly stimulates beta 1 receptors, and it is a powerful drug for increasing the pumping ability of the heart. It increases cardiac output, meaning more blood is pumped out with each heartbeat. It also slightly increases heart rate and reduces the resistance in blood vessels. Dobutamine is especially useful in acute heart failure and cardiogenic shock when the cardiac output is low. The usual starting dose is 2.5 to 5 micrograms per kilogram per minute, and the dose may be increased up to 20 or even 40 micrograms per kilogram per minute if needed. Unlike norepinephrine, dobutamine does not significantly increase the blood pressure and may sometimes lower it because of its mild vasodilator effect. Common side effects include palpitations, tachycardia, irregular heartbeat, chest pain, and low blood pressure. Remember one simple point: dobutamine mainly helps the heart pump stronger. Now, let us talk about norepinephrine, also called as noradrenaline. Norepinephrine is the first choice vasopressor in septic shock. It is main action to constrict blood vessels, which increases blood pressure and improves blood flow to the vital organs. It mainly acts on alpha 1 receptors with some beta 1 activity that slightly increases heart contractility. Norepinephrine is commonly used in septic shock, vasodilatory shock, and cardiogenic shock associated with severe hypotension. The typical starting dose is 0.05 to 0.1 microgram per kilogram per minute, and the infusion is adjusted to maintain a mean arterial pressure of at least 65 millimeters of mercury. Possible side effects include high blood pressure, irregular heartbeat, reduced blood flow to the fingers and toes, and tissue injury if extravasation occurs. A simple way to remember norepinephrine is that it raises the blood pressure by tightening the blood vessels. Now, let us summarize the differences between these three drugs. Dopamine has dose-dependent effects. It can increase the heart rate, improve contractility, and raises the blood pressure depending on the dose. Dobutamine mainly improves the pumping function of the heart and increases cardiac output. It is commonly used in heart failure and low output states. Norepinephrine is a strong vasoconstrictor and is the first line drug for septic shock because it effectively increases the blood pressure. Here is an easy way to remember these drugs. Dobutamine pumps the heart. Norepinephrine raises the pressure. Dopamine does both depending on the dose. So, thank you for watching. If you found this video helpful, please like, share, and subscribe for more medical and critical care topics.